In this video, I will talk about the clinical presentation. So what are the signs and symptoms of these patients with myasthenia gravis? But if you haven't watched part 1 and part 2, where I talk about the physiology and pathophysiology of myasthenia gravis, well, I recommend you to do that first. And I put the link down in the description. So let's get into clinical presentation. First of all, the main sign and symptom in patients with myasthenia gravis is weakness. But as you know, there are many factors that can lead to weakness. So for that reason, we have to take a look at few features that are seen in this weakness, specifically in myasthenia gravis patients. And the first one is painless. So the patient might not complain about any pain related to the weakness. Second of all, irregular or fluctuating weakness, and that means that sometimes the weakness is worse and sometimes is better. And one of the characteristics of patients with myasthenia gravis is that, well, they might tell you, oh, in the morning I feel so energetic, but end of the day I just feel so tired and exhausted. So there are huge difference in the energy level seen in the morning compared to the evening. And another thing is that the weakness worsens with sustained effort. And that can, for example, be that if you tell the patient to count numbers from 1 and upwards, what you notice is that the pronunciation will actually become slower and unclear. And that's because the muscles just get exhausted. And that's why you will see this difference. And the weakness gets worsened with the sustained effort. And if you remember, there is another disease called Lambert-Eaton disease, which is also an autoimmune disease where there's also problems in the neuromuscular junction. Well, the difference between myasthenia gravis and Lambert-Eaton disease, well, one of the differences is that in Lambert-Eaton disease is that the weakness actually improves with sustained effort. So that's a very good thing to remember when it comes to distinguishing between these two diseases. And another thing is that you have to keep in mind is that stress or pregnancy or any infections, all these things will exacerbate the symptoms of myasthenia gravis, and that's simply because the body is just working harder in these conditions, so the muscle weakness will be worse. And also important to remember that certain drugs can alter the neuromuscular transmission. For example, certain antibiotics can exacerbate the symptoms of patients with myasthenia gravis. For example, you have a patient with myasthenia gravis that are hospitalized because of pneumonia, and this patient is given antibiotics like macrolides such as azithromycin. And so what this patient will experience is that symptoms of the myasthenia gravis will worsen. So that's very important to remember. And other drugs like, for example, beta blockers such as ismolol or metoprolol, or certain antipsychotics, for example, phenothiazines or sulpride, can go in and make the symptoms of myasthenia gravis worse. So it's very important to be aware of the medication when it comes to that. Now let's talk about specifically which symptoms are caused by these muscle weakness. So in myasthenia gravis, the symptoms first appear in top region of the body, so in the head. And as the disease progresses and becomes worse, well, then the symptoms might appear in the lower part of the body. And if you remember the disease I just mentioned called Lambert-Eaton disease, well, in that case, it's totally opposite, because in patients with Lambert-Eaton disease, they will first see symptoms appearing in the lower part of the body. So for example, difficulty with walking, and as the disease progresses and becomes worse, well, then the symptoms in the upper body might appear. So that's another good way to distinguish myasthenia gravis with Lambert-Eaton disease. So let's get into the symptoms that are seen in myasthenia gravis. First of all, the patients might have ptosis, which is when the upper eyelid becomes weakened. So if you tell the patient, look up, that might look fine for a few seconds, but afterwards their upper eyelid will fall down. So if you see here, they will start closing. So that's very characteristic of these patients. And also they might have diplopia, which is double vision. And also these patients, because their facial muscles have become weakened, well, they might look sad or sleepy all the time. And some patients even look expressionless, which we call for mask-like appearance. And also these patients might have very characteristic smile, which we call for myasthenic snarl. And that looks like when a dog is growling, and that's because their buccinator muscle has become weak. And also some patients might have their mouth hanging open all the time, again because of the muscles that are weakened in the face region. And as the disease progresses, well, then there might be problems with the bulbar region, and that refers to the medulla oblongata in our brain. And when that happens, well, then we might see symptoms as dysarthric speech, which is unclear speaking or slowness of speak, and that's because the phonation muscles, or so-called the muscles that are responsible for speaking, will they become weak. And also some patient might have problem with swallowing, so that's called dysphagia. And as the disease progresses and becomes even worse, well, then we might see that these patients have shortness of breath. And that's because that the muscles they're using for breathing, well, they become weak. So that's a very severe case that we see that. And also, as I mentioned, that usually it starts in the upper part of the body as first, and as the disease progresses, then the symptoms might appear in the arms, so weakness in the arms and their legs as well. So in 60% of the cases, it will only be in the face area, and in less cases, like around 40% of the cases, the symptoms might progress to the lower part of the body. But there is a good way to distinguish between these different stages, and so in Myasthenia Gravis we divide them into 5 different classes. So the class 1 is ocular muscles, so these patients have only problem with their eyes. And class 2 is mild generalized weakness. And generalized simply just refers to that is not only focused in one area, so in the head region. It can also be that they have problems with their arms and legs at the same time with their head. So that's what's referred to generalized weakness. Then we have class 3, which is moderate generalized to mild moderate bulbar weakness. And then we have class 4, which is severe generalized or ocular bulbar weakness. And the last one, which is myasthenia crisis, which is the worst case. And that one we will talk about in the next video, where we talk about the complications. And also in the next video, we will talk about the diagnosis and the differences between myasthenia gravis and cholinergic crisis, because often it can be mixed up because the symptoms of these two cases are very similar. So if you want to learn more, then keep watching the next video where I will be talking about diagnosis and the complications.